Welcome to episode 28 of the Yoga Meets Movement Science podcast. On this episode, we are going to be talking all about lumbar flexion, or rounding of the low back, and in particular, whether or not it is dangerous. So we will start off our conversation talking a little bit about the anatomy of this region of the body, as well as some common injuries that can occur. Then we'll talk about some of the different ways that you can flex your low back, in particular, different ways or different styles of picking things up off the floor or bending over if you're talking about a yoga context like a forward fold, or maybe picking up weights in a weightlifting context. We'll discuss some of the early research on quote unquote neutral spine and what the more up-to-date research has to say on that topic. And then again, we'll examine all of these ideas in yoga, in just our daily lives in terms of picking things up, as well as in the gym. And if we have time at the end, we might get to some listener questions as well. To help us address this topic thoroughly, we have invited on a very knowledgeable guest, our friend Sam Spinelli. Sam is a doctor of physical therapy. He also has his CSCS, Certified Strength and Conditioning Specialist. He is from Kelowna, British Columbia in Canada. He owns and operates his own private training facility, as well as he is the co-founder of E3 Rehab and Citizen Athletics. And overall, he just does a really awesome job educating on rehab, fitness, and research, and all of these things. We learn a lot from Sam. His social media, his YouTube is top notch, especially through those companies that he co-founded. We'll link you to all of those resources in the show notes. And also, Sam is a self-proclaimed cake aficionado. So maybe he'll have the opportunity to share with us a little bit about that, or maybe not. But just again, to reiterate, we really, really respect Sam and everyone that we know in the rehab world does. So we are excited to have him on with us. So welcome, Sam.
Thanks for having me on. Excited to be here. Yeah, it's wonderful to join you guys and talk about this. I'm really honored to be on.
Oh, we are so happy to have you on. And yeah, like I echo everything that Travis just said in the intro, but I must have been following your work online. I mean, just for years, I feel like. And I've learned a ton from everything that you put out. And I'm sure you get this a lot, but I also often direct people to like your E3 rehab videos. Whenever you have so much good content out there on
Every
so many.
time.
That's the whole goal.
Anytime somebody asks me a question, I'm just like, let me see if E3 Rehab has a video on this.
You go
and like every time you guys do. So like, thank you for that, because it makes everybody's life easier. And I can just, I know that I can trust the information that you're sharing. So it's just such a valuable resource.
Thank you. If you or the listeners have any suggestions, we're always looking for more topics and trying to round out to be exactly that resource. Can we provide good education that others can benefit from, that can shorten other people's time, that can be a quick access, and be something that is going to be able to empower people, educate them, and allow them to have some practical resources.
Those were two of the three E's. Is that true?
Yeah.
What's the third E?
What's the third E?
Evidence. Yeah.
Okay. Oh, right.
Brilliant.
I forgot the E3 stands for 3E.
Yeah, it's funny. Like, people think that it's because there's Mark, Tony, and I. And they're like, so what is the E about? And I'm like, it's actually got nothing to do with the three of us.
There's an E in Spinelli.
That's true. You could find it in there.
But Mark doesn't have an E.
No, he doesn't. Yeah.
So he's the odd man out.
He's cut. Sorry, Mark.
So anyway, so it's such an awesome resource. And also I really appreciate how positive and diplomatic you guys are in like the education that you put out there, and not so negative or confrontational. I just think it can be really effective that way.
Yeah, we try to think like there's like right now, I know there's a handful of channels that are more popular that take the other route, and I think like just in the long term, you don't necessarily reach as many people. You just like deal with more backfire effect. You challenge people's
Right.
beliefs too strongly, or like they can't, they're not open to changing their alternative if they're presented information that way. So
That's a great
I
point.
think it shows like with the reach that we've gained on especially YouTube.
My
Right.
perception, and maybe I you can tell me if this is right or not, but like you said, there are people who maybe attack other people who they disagree with, and like you said, that can be click worthy,
Mm-hmm.
but it can have that backfire effect where if somebody perceives it as negative, they further entrench themselves in their own beliefs. But then, like from my perspective, you guys are you don't get mixed up in that. You just put out really solid
Mm-hmm.
information, really high quality. And like the idea is, well, over time, we're going to be able to rival some of those, like those other accounts that are maybe spreading misinformation. So we don't have to, we don't even have to negate what they're saying. We can just reach more people with the good information. So it
Yeah.
drowns out the bad stuff.
Exactly. Yeah,
I
that's
think
been the
that's
whole goal.
really well said, Travis. And I totally agree. And I'm sure that Sam is going to use that signature style of like this diplomatic and positive education in what we talk about today
Setting the
about the
bar
lumbar
high.
spine. Yeah, exactly. So speaking of that topic and what we want to focus on today, we were wondering, Sam, if so like the lumbar spine, which is the low back region. I think most of our listeners are probably just aware of the fact that that area gets a lot of attention, especially in like the movement world, the fitness world, the yoga world. We tend to hear a lot of like cautions around this area and these ideas that we need to do. It's really important that we do specific things to protect this area. And especially a lot of warnings around lumbar flexion, which is the rounding of the lumbar spine. So before we like dive too much into all of that, we were wondering, Sam, if you could just kind of provide maybe like a basic intro to the anatomy and the structure, and maybe a little bit about the biomechanics of the lumbar spine region, just so we all know what we're talking about.
Well, I'll try to do a good job of the biomechanics, talking next to Travis. So,
Right.
but
He can,
yeah, let's let's
yeah.
let's get rolling. So, when we're
Cool.
talking about the lower back, I think the easiest way to generally start the conversation is it's going to be the region between your pelvis and your ribs. Simple
Hmm.
classification. And then as we start to dive into like what that means, you've got the bony anatomy. So we have our pelvis that then matches up to 5 lumbar vertebrae that then ends up coming to your thoracic region or where your rib cage is. And then that's surrounded by a lot of ligament tissues. There's ones that are around the outside of your spine, ones that run along inside the spine. Then you have nerves that are traveling down through your
Hmm.
central canal and they pop out through the sides. And then there's a ton of dense muscular tissue that's in the region. You've got things that are you got muscles that are really small, like your rotatories, and then they start to get bigger, like the multifidi. Then they get even bigger, like your spinal rectors, and they get even bigger, like your latissimus dorsi, otherwise known as your lats. And so you guys just got this huge expansion of things going from smaller to bigger. And then something that we'll definitely discuss in a minute. You've also got your discs that are in between
Hmm.
each lumbar vertebrae. And so that's pretty much the major aspects of the anatomy of the region. Then, as we start to look into the biomechanics or the motion of the area, we've got a few different major ones. So, when we start to look at how the lumbar spine moves, looking at segment to segment, we have the ability to flex. So, that's essentially like going into a forward bend, or
Hmm.
if you're laying on your back, your knees coming towards your chest. Anytime that your front of your chest and your knees are coming in closer proximity. Then you have extension, which is the opposite motion, more like an upward dog. And
Hmm.
then as you start to look at two other motions, which are a lot smaller than the lumbar spine, you have lateral flexion, so like a side bend. And then
Hmm.
you have, again, rotation, which is um, essentially your legs stay in place, you rotate your chest, or the opposite, chest stays in place, rotate your legs. And when we start to look at the lumbar spine and we compare it to other spinal segments, it has more ability to flex and extend and less for rotation side bend. However, it still doesn't have a ton of motion because when you start to look at it, there's only 5 segments. They're really not very big. They don't have a lot of space between them, so they actually can't move a ton, which is going to be important in our conversation later. So a lot of times people think that there's like this major motion that occurs at them, but as we start to look at some of the or discuss some of the research later on, a lot of motion that is often perceived at the lower back is likely more either pelvic motion or actually thoracic motion. And it's a bit mixed up, I think, in some of the way that we talk about this and why there's been so much, I guess, backlash with what some of the research shows versus what people themselves see. And
Right.
yeah, because like for instance, something that we'll get into is like when the pelvis moves, your lower back will move. And
Yeah.
sometimes people don't think that's the case, but if
They
your
don't.
if your pelvis, if your hip goes into flexion, your pelvis needs to start to go forward, and as that occurs, you're going to have associated lumbar motion. And if the opposite happens, your hip goes into extension, you'll have associated lumbar motion. And so we see that there's just like this coupled action where if the pelvis moves, the lumbar spine will move. So, for instance, like when you go from a upward to the downward dog, you could try your absolute best to not move your lumbar spine, but it will have to move. I realize in yoga you would let it move, but if for some reason you perceive that you needed to maintain a neutral spine in both of those exercises, it would be impossible.
That makes a lot of sense.
Should I describe neutral, by the way?
Oh, yes. Could you? Thank you. Yes. What's neutral? What's a neutral spine?
Yeah, that's like this general concept that's been floating around since probably like the 70s, where there was an early researcher named Punjabi, and he started to first describe it basically as like a range of motion where there was just less loading on different segments of the spine. And he generally defined it as being, this is a huge range, by the way, 300% of the normal range of the spine. So it was like a very large degree of motion that could occur. And then, so when you start to look at it, what that actually means is basically like you have an outrageous amount of motion. And if you just get to the very end ranges, that's when you're technically outside of neutral within his terminology. Whereas like people generally mean it as like if you look at someone's spine when they're in standing, that's neutral. And like should you flex or extend past that point, then you are no longer in neutral. That's usually what people kind of describe it as.
That makes sense. I feel like I've heard discussions around neutral spine being described as like a static position, like you kind of click in and you're in neutral or you're not. But I've also heard language around there being more of a neutral zone, which like maybe allows for a little, maybe not as much movement as you were describing with the Punjabi research. I think you said that was his name, but something a little more narrow. Could you speak to that at all? Like static position versus a zone?
Yeah, I think that was one of the first things that started to get discussed as there was this exploration of that you probably can't maintain a singular position as you move. And so then people started to get a little bit more comfortable with that will allow a zone of it, not using Punjabi's definition, but just saying, okay, so we see that in standing, you have this singular position, which we'll call neutral, upright torso, pelvis in level-ish position, ribcage level-ish position. So then your spine is in 7 degrees of extension, something like that. So then we're going to call that, boom, neutral. But then should you sit? Should you walk? Should you squat? Should you do any sort of activity where you begin to move away from perfectly upright standing? We'll have this range that we're going to call neutral. And that's a okay zone to be in and doesn't excessively load the spine, I think is how people generally describe it.
Do they ever put a number on it? Like, okay, it's this plus or minus something.
I don't think so. Do you?
I don't know.
I feel like people generally leave it really vague because then they're not held accountable to it.
Yeah, that makes it easier. Well, also, like, let me bust out my MRI glasses to make sure that you're with plus or minus whatever this range is, right?
So, Sam, I noticed that when you were talking about the neutral zone for the spine, that you made reference to, like, one of the ideas is that if you stay within this general neutral, that you're okay, like that will keep the spine okay, which just then makes me wonder about uh, what are the potential risks or potential injuries that could happen? Like, what are we talking about in the lumbar spine region? Injuries that may happen that could be associated with not being in neutral.
Yeah, that's a great question. So I'm gonna do my best job to be as descriptive without inducing too much fear. So there's a
Love
range of
that.
different there's a range of different descriptions about changes that we see in the spine. It's hard to describe them as pathological, which we would generally uh, refer to as bad things. Like you don't
Mhm.
want this change to happen. However, we have a lot of growing research to show that these things occur without having any symptoms. These things, some of them might be natural parts of aging. Some of them, which I'm going to mention for sure, because I think this one relates especially to yoga, may have occurred during very young adulthood or even childhood. And you just may have never known about it. And then, should you ever go and get some sort of imaging done, then they may have found something like this. And so I'll describe them and just keep that little disclaimer in mind. So,
Mhm.
one of the most notable ones that people hear about is probably a disc herniation, disc
Yeah.
bulge, some sort of description following that. And that's where, in essence, the disc that we described that's in between the vertebrae has started to push out. It
Mhm.
may be pushing out while still being held in by the annulus fibrosus or the outer layers. It may have come through them. It may have gone small, further, just generally some sort of level of that. And then there's the extreme case of where like it actually bursts. That's super rare. And when that occurs, you would definitely know about it because it's a very serious injury.
Mhm.
Then on the flip side, we have other injuries or other changes that can occur. For instance, one that's often not discussed, but it relates to the discs, is an end plate fracture. So where your annulus fibrosus actually attaches to your vertebrae is called the end plate. And when the a little tiny fracture essentially occurs to that region, it's called an end plate fracture. It's way more common than previously thought and really related to further degrees of motion, essentially. So that's where it'll probably come up when we discuss this later on. Then we have other changes, such as like a spondylosis, spondylolisthesis. There's three of them. Spondylitis,
Sort
I
of
think is the
like
first one. Yeah.
lysis.
Yeah. So
Yeah.
essentially, they're just like different changes to the actual bones. So you've got the first one, which is where we have some sort of increased bone density essentially around the region, sometimes called an arthritic change. However, seems to be just a normal part of aging. So some of the terminology around that's beginning to change. Then you have the next level where there's a tiny little fracture that occurs in a part of the spine, spondylosis. And when that occurs, if you were to take an image from the side, you can see a little line that crosses one part of the back part of the spine. And then as you go to the next level, spondylolisthesis, sometimes there's actually slippage where the fracture line has now separated, and
Mhm.
one level of the spine relative to the other is not in that straight linear alignment anymore from a side view. If you look at it from
Mhm.
the front, back, you wouldn't notice this. And then those are that can be graded usually from grade 1, 2, 3, or 4, and it's basically a percentage of 0 to 25, 25 to 50, 50 to 75, 75 to 100. And so then sometimes it's given like a grading scale. Then you have scoliosis. So I mentioned when you're looking at it from
Right.
the side, you would see with the spondylolisthesis that there's a change, but from the front to back, you don't. Whereas in
Mhm.
scoliosis, it's relatively the opposite, where if you look at it from a side view, you don't necessarily notice distinct changes, whereas front to back, you notice more. Um, Again, scoliosis has like a grading system. It's called the Cobb angle, and it's basically looking at
Mhm.
how much of a change there is when you're comparing segment to segment. I think it's like in the vast majority of adults, up to 25 degrees is really common. And once you start to pass 25 degrees, that's where you start to notice more hindrance on movement. And then once you pass 50 degrees, I think is when you start to see distinct challenges with scoliosis, where it can like impair breathing, it can impair organ function, and is usually then surgically managed. Whereas like it's something around like 65% of adults have less than they have scoliosis that is between that 0 and 25, and it's asymptomatic, not an issue. I have it. Probably one of you two has it.
Yeah, right.
Then we also have other changes that can occur. So you have ligament sprains. So, like for instance, you have one called your posterior longitudinal ligament. It runs along the backside of your spine. You could theoretically strain that. You also have muscular strains. So, like if you were, I don't think this is probably as common in yoga, but if you were doing like a really fast movement with some resistance, you could strain one of the muscles and have a theoretical like muscle tear of it, essentially. Am I missing any?
It's a strong list.
Yeah, exactly. And I feel like that's really thorough and awesome.
You also have like it falls under the spondylosis category, but you have degenerative disc disease, which is
right. That's
it's basically like sometimes again called arthritis. Different versions of it. Super scary when you get an image that says it, but it basically happens to everyone as you just get older.
Right. Yeah, that's when people say, my doctor said that my back looks like that of an 80-year-old.
Yes.
Yeah.
It's a scary sounding name. Degeneration of your
that's why I fear like giving a lot of the descriptions, because I mentioned like spondylolisthesis. It's around like 50% of the cases of them they find are like extremely related to early childhood. So if you go and scan 2-year-olds, there's a study where they went and did MRIs on 2-year-olds back, and 3% of them, something around there, had a spondylolisthesis. And it's just
how
like
many percent? What? 3?
It's around like 3%. Wow. And then in adults, like the incidence of spondylolisthesis is like 5%. So that's where 50% of them, a little bit more, actually likely is associated having occurred before you even had any idea that it was there. And that's where it's like tricky, because people will get an MRI, X-ray, something, be told that they have this, and it's like, well, you could have had that for 40 years and had no idea.
100%. And is it also the case with many of these other, like, I guess, quote, pathologies, which I guess we're not really necessarily using that term, but isn't it the case that many people do, like on a structural case, actually have many of the, or, some of these examples that you mentioned, yet they're asymptomatic, they're pain-free, they wouldn't even know it was there unless they got an MRI.
Exactly.
Or some sort of scan.
And same with like they may have had it before the MRI. Like I think a disc herniation is probably the most common one, where it's something like around 20% of 20-year-olds will have it, 30% of 30-year-olds will have it, and then it actually starts to increase even higher, to where if you go into 80-year-olds, over 90% of them will have one. And it's like, when you consider that though, like you have so many vertebral levels that you could have so many disc herniations occur, and
that's a great point.
Yeah, they're just a asymptomatic thing that can generally occur. Like they might be related to symptoms at times. Well, one more that I probably should mention, because we just got into older population, is a vertebral fracture, usually like a compression fracture. So super low incidence in younger populations, but I assume you guys probably reach older populations too. So if you're 45 plus, then they start to present, especially if you're postmenopausal, then there's a way higher incidence of them.
And that would be like a fracture of the vertebral bone itself?
Yeah, so like there's when you're looking at the vertebrae, like the vertebral body, then it basically is like a fracture in the center, and it kind of squishes. And that's why it's called like a compression fracture. And it's it's really
I
tricky
see.
because if you go scan a whole bunch of people in their older age, they pop up a lot, and
Mm-hmm.
it's really common. Like I used to work at a facility where older individuals lived, and if they were to fall, they would instantly get an X-ray, and they almost always found a
Right.
compression fracture, and that was the
Right.
cause of their pain. And it was really hard to negotiate that because often people would find improvement, but if you go and check the X-ray, it would still be there.
Right. And when you
Same with,
said that,
I was just going
sorry,
to say, there's also the opposite situation where people can have a anatomical change occur through surgery, and then their symptoms don't change.
right. Right. So like what we feel in our body, pain wise, isn't necessarily always connected to like the actual structure, or the tissues and what's going on there.
Yeah, definitely. I think that it's a really hard one to navigate because we have this perception that, if I have a change from what is called normal, that's the cause of my pain. However, we
Yeah.
probably need to update what our definition of normal is.
Yes.
Also, understand that changes are really common. They do have a place where sometimes the occurrence of them might be related, but in the vast majority of cases, I think the latest Lancet paper said only 2% of anatomical changes on imaging are actually distinctly related to symptoms.
Wow.
So,
2%?
yeah, it's a pretty small amount.
Wow.
Yeah.
So it just seems like it could just be so likely for someone to have some pain in their body, go to the doctor, get imaging, and then the scan shows, this a herniated disc or a something, and then that just gets, like you said, blamed for the pain. And
Hmm.
in some cases, it could be connected, but in many cases, it could have been there well before they ever even had the pain. But then they get this idea that that's the reason.
Yeah,
It
because
just
even in the
seems
case of like asymptomatic people, there's one study that looked at imaging their lower backs, then doing a follow up. I think they did 2 and then 5 years later, and seeing how they changed. And some people had a disc herniation in the first image, and then didn't have it in the later one, and they were asymptomatic through the whole time. So they had a disc herniation present,
right.
it reabsorbed,
That's
and there was
right.
no back pain incidents during.
That's another interesting fact that I'm not sure everyone knows about, but that disc herniations can reabsorb. They can heal. Like they're not necessarily
Yes,
permanent.
yeah, like a lot of these things, some don't change. Like, hopefully the term disc degeneration doesn't sound as scary now, but like it doesn't quote
Oh yeah,
unquote improve or
right,
reduce. But on the flip side, like disc herniations reabsorb, end plate fractures can heal just like other fractures can. Yeah, a lot of these things can uh, improve if we're going to call them bad. Yeah.
right, right. Well, out of that list of things that at least just on like a structural basis, you might label as like a change, or some people might call it pathology or something that can happen in this region. I don't know about you, Travis, but I feel like in the yoga world, a herniated disc seems to be the one that's like gets a lot of the attention. Is maybe the one that's like held up the most as like a thing we need to worry about and protect against. And I'm wondering, my impression is that perhaps some of the attention placed on disc herniations, and their connection to like lumbar flexion maybe are connected to some work that I'm wondering if you could maybe lay the backstory for us a little bit, Sam. Work done by a very well-known biomechanist named Stuart McGill, who I find in the yoga world that many people who know of him think that they take they believe that the work that was done by him years ago is still the working model today. And I think they just like really they see him as an authority, him and his work as an authority, and what he says about the spine and what he says his research suggests. So could you maybe offer a little backstory about what he did, what his research showed, and how it
Uh,
influenced what people think?
I think that's not exclusive to the yoga world. It just so happens that
Yes.
people in the yoga world know about Dr. McGill because he's done some work in collaboration with other
He's done,
yogis,
yeah,
right?
I know he's done work specifically with Bernie Clark, who's a yin yoga teacher. I know the two of them have done like a online course together. that's I think
Oh,
it's called Your Spine, Your Yoga. Although I could be, I didn't think I was
Sounds
going to
good.
talk about this today. That could be just Bernie Clark's book's name, but I think that's the name of their course anyway. Yeah, so he has a presence in the yoga world. But you're right, Travis. For sure, Stuart McGill is like much big. Tons of people know of his work beyond.
And his mustache.
and he's
Yeah, it's kind
Canadian,
of famous.
so
Oh,
There you
that's
go.
right.
So everybody in Canada knows each other, right? So you're
exactly.
You're
only
best friends with
one.
him.
Yeah.
I wouldn't say
Yeah.
that. I do usually give a preface like I can come off as having a distaste for him, but I have a
Mm-hmm.
lot of respect for the work he's done. I just think that
Mm-hmm.
the inferences of his work have been misguided, particularly in more recent times where we've had a lot more research.
Mm-hmm.
The research he did early on, his lab did a lot of studies that helped to increase our understanding of a lot of this tissue challenges, the loading that they can take, when their structures are challenged versus not challenged, when they begin to fail, which is really helpful. However, there's a lot of limitations with the research and understanding it, particularly in the context of exercise and what we do,
Mm-hmm.
should be factored in because, like one of his most notable studies, which I'll expand a lot more on, for instance, is where they had individuals do lumbar, or they had a spine do lumbar flexion repetitively, and eventually there was failure in a lot of the tissues. However, something that's not considered is like they used porcine models. So they're pig, which is not necessarily a bad thing, but they're dead pigs. So they don't have the ability
Right.
to heal. So, first
Yeah.
off, I assume all of our listeners have that ability. And then the next aspect to it is that there was, and this most famous one, there was 86,400 continuous cycles, which I've never done. And I assume most people have never done. I
And
think
you're an
that
avid exerciser.
I am. I think that like I looked it up one time. The crunch world record is less than that. So even in the guy that did like the most
What?
crunches in a row didn't reach that number.
I
So
love that you looked that up. That's awesome.
yeah, and so when you start to layer on some of these things, there's just a lot of
Yeah.
limitations to it. But
Yeah.
when we start to go back, Stuart McGill started to do a lot of his early research, and I'm not too sure if he started in the 70s, but for sure in the 80s and then into the
Mm-hmm.
90s. And he started to put out a lot of publications. He started to write books on the topic and started to look at how the spine functions when it gets loaded,
Mm-hmm.
particularly in cadaver models, doing things where they would basically bend and extend it, or they would do compression studies where they would squeeze end segments together. They would do different
Right.
styles of them, such as repetitive flexion extension unloaded. They would do repetitive flexion extension with progressively more load. They would do instantaneous pressure versus gradual pressure. So a lot of
Mm.
different types of studies on this, which helped to gain a better understanding of when will we see a disc herniation versus when will we see an end plate fracture versus a
Mm-hmm.
spondylolisthesis. Any of these types of things occur, and then also doing EMG studies. I actually just quoted him the other day, which
You did.
the video is not out yet, but it's discussing quadratus lumborum function because
Mm-hmm. That's a low
he's
back muscle.
actually it's a low back muscle on each side, and he's one of very few people that have actually looked at it. So he did a indwelling catheter study on it, which was he did it in like the mid 90s, and which the old research that people used to do, really cool.
Right.
I don't know if you could get a lot of people now to let you like stick a needle in really far and then do a bunch of exercises. Like he had people do
No.
heavy deadlifts with a indwelling catheter into their QL.
Oh my gosh. That sounds so
Crazy.
uncomfortable.
Yeah.
Wow.
IRBs weren't the same back then. Institutional review boards that allow you to do research on human subjects.
Right.
Yeah.
That decide whether it's ethical or not.
Yeah, I remember I took a cardiorespiratory physiology class in my last year of undergrad, and we were looking at some old Swedish research, and they were able to convince people to do like a VO2 max test with a thermometer up their backside,
Anus?
and to be able to get like a core temperature change.
Whoa!
And then at the same time, they also had a probe coming in to their stomach so that they could have another temperature, and they wanted to compare the differences and do a
Oh
VO2
my
max test.
gosh!
And these were people, I remember they were getting like in the 60s to 70s for their VO2, which is like a solid score. So these are not, you're convincing high level athletes to do this, which is pretty crazy.
Wow,
VO2
man.
max test is hard enough by itself without getting stuck from both
Both
sides.
ends.
Totally. But Sam, I really appreciate how you would mention that, like, you would cite research from Stuart McGill today that is, that's like relevant to what you're wanting to talk about, and just, I guess, maybe to make that point that, like, the biomechanics research he does is valuable, or that has done is valuable for our understanding of, like, maybe tissue mechanics. It's not to like brush all of it aside. Maybe it's more like the extrapolations that have been made or that he made based on the research, and that maybe are still kicking around today that aren't
I've
necessarily as supported.
I've wondered for a long time, like whether it was his interpretation and overinterpretation, or other people's
Mm-hmm.
interpretation and overinterpretation. And I long wanted to give him the benefit of the doubt, but I think some of it, like, he's to blame a bit.
Travis.
Yeah, I kind of fell
Right.
into the same camp as you, Travis, and then I started to get pushed more. Not to make this into like an angry rant or anything, but
Right. No, it's
there's
fun to
a
hear.
there's a paper that he did on I think it's called something or another examination of hip arthrogenic inhibition, and it's like a paper that's commonly used to say that the glutes don't turn on.
Oh, the sleepy
And
glutes.
yeah, it's like the main paper that's used, and like studies cited all the time saying that, oh, this is proof that your glutes don't turn on, blah 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 blah. And it's an incredibly impractical study because they actually like went into people and then injected them with like I might not have the number perfect, but I want to say like 5 cc's of fluid directly into their hip joint, and then they
Right.
assessed like if it could function still the same, and obviously it didn't. Like we know this from like pretty much every joint that if you just inject it with a ton of fluid, it stops functioning. And
Right.
they saw the same thing with the hip, which like when you look up how much someone, for instance, that experiences FAI, um, very bad, quote unquote bad, osteoarthritis in that region, like the
Mm-hmm.
amount of swelling that they induced was 20 times what the average case of that
What?
will be. And so,
So
like,
not even
yes, they shut
realistic.
down the glutes, but it's extremely unrealistic where you will never see that occur.
Yeah.
And in the discussion, they directly say this is proof that this happens. And so then everyone quotes that little section in there in their
Yes.
studies.
Oh,
Yeah.
that
So the
makes
Yeah.
research design makes sense because you want to take it to an extreme to see if you can create the effect, but then when you over
right.
interpret the conclusions, and then you're the foremost spine biomechanics researcher, makes it easy for other people to just take your conclusion and run with it.
Yeah. And that's where, like, again, we have a lot of very good research from him, but then it has to be put into context. And
Yeah.
that's the part that I think has either been on his part or other people's part missed. Because, for
Mm-hmm.
instance, like if we do say, okay, well, if we start to have repetitive lumbar flexion extension where it's taken to 300% of normal range, which is the standard study utilized, and you look at like at what stage did disc herniations occur, it's in the like 60 plus thousand cycles. And so you're probably not seeing
That's
that
so
generally
many
occur.
times. Right.
Yeah, and they had actually some specimen that didn't end up fracturing or having
Mm.
a disc herniation occur. And whereas like they saw other injuries occur, for instance, like for some reason this doesn't get discussed as much. Like they saw spondylolisthesis occur, so like fractures on the opposite side, and it's likely just because they were having the bones approximate repetitively over and over
Oh,
again.
yeah.
And yeah, so there's a lot of
Yeah.
valuable information. You look at it and say, okay, well, if I have someone repetitively go into these different positions, there will be
Mm-hmm.
a stress that undergoes that will challenge the bones, the ligaments, the discs, all these structures. However, the part that's missing is like what happens in a human if I
Mm-hmm.
give them time between bouts of this, And as we've now gained more research examining this, we see that adaptations to these different structures can occur. We can have
Yeah.
increased bone density at end plate fracture sites, which is something that would normally fail in repetitive loading. We see
Right.
that the disc can thicken. We see that the disc can have increased fluid levels. We see that the bones on the backside can have increased bone density as well. So a lot of these things can have very positive adaptations if they are stressed and then given time to adapt. Because
Absolutely.
yeah, like the majority of the early research was on cadavers, which, as Travis mentioned, like you want to take these things to the extreme because they give you a starting fundamental
Yeah.
concept. But then you look at, okay, well, now if I start to take the same model, I look at it in living subjects, do I see the same line occur, or is there some sort of separation in the findings? And there is a separation in the findings, at least in a lot of this.
That
So yeah,
makes.
when
Sorry, go on,
people
Travis.
when people use that research and say, "Oh well, we have a limited number of flexion extension cycles,
They
so
say that, yeah.
we need to avoid
Mm-hmm.
or be like cautious of using our finite number of cycles. Therefore, I need to not put my socks on. I need to like not bend
Travis,
over to put my
not put my
socks on,
socks on.
or not.
That's
Yeah.
But that's
real.
it's a real
Yeah.
thing I've heard, or not bend over in a yoga class. And it's like, hold on,
Yes.
like maybe that's an over extrapolation.
Yeah, especially because, if you start to look at the research examining the positives of these things, for
Mm-hmm.
instance, when you look at disc hydration, so your disc doesn't have great blood supply to it. And so
Mm-hmm.
then the way that it stays, we'll say, healthy is through
Mm-hmm.
osmosis, and then the fluctuation of the fluids inside of the disc. And when you look at something, for instance, like a forward bend, it helps to push that fluid backwards towards the backside of the spine, which in most normal standing, it actually doesn't get. And so having the fluid shift backwards is associated with improvements in the health of it.
That's amazing that you point that out. So it sounds to me, Sam, is what you're saying, that when you say forward bend, you mean spinal flexion, like that
Mm-hmm.
movement that we tend to hear a lot of cautioning around in the yoga world, the movement world in general, as though, like Travis said, we have a limited number of those, and we're going to herniate a disc if we do too many. But it seems like you're implying maybe like holding ourselves back from spinal flexion may hold us back from potentially like nourishing the discs, at least in the sense that moving in certain directions can help distribute nourishment and keep them healthy.
Yeah, absolutely. I think when you start to look at the research on pretty much any tissue, that if
Mm-hmm.
you take away loading to it, so you avoid a range of motion, you avoid a certain line of stress, whatever it may be, it will likely have negative adaptations where it decreases the ability to take load, decreases the ability to tolerate
Right.
strain, whatever it may be. I think the tendon research that we have is a great example of this, where there's basically like a U curve of where if you underload it or overload it, you see basically the same response in the tendon, whereas there's this big range of middle zone where if you give it some degree of loading, it has a positive response. And while we
Mm-hmm.
don't have the same research done on all other tissues, there's probably a similar concept to them. It's just like what that amount is.
That makes so much sense.
And that's
Abs-
not even to mention all the other benefits, like the non-physiological
mm-hmm.
benefits.
You that like come from movement,
Or
Travis? Is
yeah,
that
or avoiding and restricting movement.
Yeah.
exactly? Yeah, it sounds to me like you're suggesting that like avoiding a range of motion, like going out of our way not to move in a certain way, could maybe ironically increase risk of injury.
Yeah,
Like
definitely.
kind of
Like
work in
at
the
the end,
opposite direction of what we think.
yeah. Yeah, I think
Yeah.
like if you consider, okay, well, if I avoid a range of motion as much as possible, should I ever have to go into that range of motion, I either
Yes.
A, might lose the ability to go into it, I might lose strength, durability, certain tissue capacity for it, whatever it may be. But then also, as Travis mentioned, like especially lumbar flexion, we've had a lot more growing research to show that people in back pain tend to lose lumbar flexion, lose range of motion, lose velocity into it, all these characteristics, which is
Mhm.
interestingly the opposite of what is commonly said.
Absolutely. And I wanted to tell you, Sam, that leading up to this conversation, I put out on social media a couple of polls just to my audience to see, like, what, like the yoga audience who tunes into my stuff, what they've heard around ideas around the spine, and spinal position. So I asked two questions. I asked, have you been taught that when you forward fold in yoga, so in yoga, we're talking like body weight forward folds. This is not like weightlifting. We don't have like weight on our back, but picture like a seated forward fold. In the yoga world, we call that Paschimottanasana. I asked, have you been taught that we should always keep a neutral spine in a seated forward fold versus a rounded spine, like that the neutral spine is better? And 89% of respondents said yes. They had been taught that when they forward fold in yoga, they should preserve a neutral spine, like that's preferred. So that was one. I thought that was actually a lot higher than I thought that people would say. 89%. And then the second question was, and this is more a daily life question, not a yoga question, but it was just, have you been given the advice or have you heard that when you pick something up off the floor, that you should lift it with your legs and not with your back? And 98% of people said yes, they had been taught that. So I feel like that, I know that's just my audience, and it's not like a super random sample or anything, but I think that's a pretty interesting look into how prevalent these beliefs are about the spine.
And the funny thing too about the forward fold with the neutral spine is that that's like the initiation of the movement, and then you're allowed to round at the end
Exactly,
in order to get into the
Travis.
end. So it's like, okay, it matters how you got there, but you're still ultimately rounding.
Yeah, I mean, in a yoga forward fold, I think if you don't allow some spinal flexion, you're not really going to get into the shape. You get into maybe like a hip hinge or something, like a halfway lift. Now I'm thinking of a standing forward fold or something. You could maybe go approximately halfway down, keeping that neutral spine. But in order to fold all the way down, we need to have some spinal flexion in there. But yeah,
Definitely. Yeah. Like when we start to look at, so you mentioned hinge. I think the
yes,
closest thing that we can look at to that is something like a good morning, which for the listeners
mm-hmm.
that don't know, you're
Yeah.
standing upright, you have a small bend in your knees, and then the goal is to push your hips back, keep your back as extended as possible as you bend forward. So basically, trying to not round your lower back as much as possible. And when they
Right.
look at how much lumbar flexion actually occurs during that movement, I believe it's 26 degrees of lumbar flexion. So when you
Still
factor that out,
occurs.
it's essentially unavoidable. And when you take that out to other movements, like we have one like the kettlebell swing, the squat, we have
Mm-hmm.
a lot of lumbar flexion that occurs when people are trying and coached by high level people to not round their back. Still, while it might not look like rounding, it's occurring.
That's
And
the crazy thing. It
yeah,
looks to the expert coach's eye that they've maintained that flat position that we want and talk about, and then when you actually have them hooked up to sensors, it turns out that they're rounding, or
and I think
there's
that's
lumbar flexion occurring.
yeah, exactly. I think that's part of the like why I mentioned early on is like some of the motion that we perceive as a flat back is
Mm-hmm.
probably actually the motion that's coming at the thoracic region or the pelvis itself, because
Yeah.
you're going to have this unavoidable amount of isolated lumbar flexion motion, but then at the um, thoracic region, especially the lower thoracic, there's a lot of flexion extension that can occur there,
Yeah.
and like in a forward bend, you probably will have that normal amount of lumbar motion occurs when you try not to move forward or try not to round your back. And then when you let it happen, it's then going to come at that lower thoracic region.
Oh, because are you suggesting that when we're trying to hold a neutral spine, but we fold forward, we are indeed flexing, even though we might not realize it. But it sounds like you're suggesting that the flexion happens more in the lower lumbar region, like the lower vertebral
Yeah.
segments. And
Yeah.
then
There's
if you
a,
allow, yeah,
mhm. Yeah,
so
there's a
yeah,
study that looked at it, and it was like comparing trying to change the amount of lumbar flexion that occurred and around 10% was changeable. So if you tried to keep a flat back versus letting it change, you could only, and this is again at the isolated lumbar region, not including the other segments that are above and below, you could only change it by about 10%. So it's, again,
Wow.
a lot less motion than people think.
I think that could be really eye-opening to a lot of people because we do kind of just have this like I feel like at least in the yoga world, but I know beyond, just this kind of gospel of neutral. Like neutral spine is super important. We all need to understand how to embody neutral in our spine, and then we need to understand how to keep neutral as we go through all these movements, be it yoga or at the gym or whatever. But I think it can be really eye-opening for many people to realize that we can't actually, like, even if we want to, we cannot really embody neutral as we move. It's just the natural way that our spine moves.
Yeah, like we do have the ability to modify it slightly, but
Mm-hmm.
if your goal is to have that neutral position at the lumbar spine, yeah, like you said, it's just gonna naturally happen. Whereas you're likely just moving other parts and thinking it's that.
That makes so much sense. I have a quick question for you, Sam, and I think some of our listeners can relate to this. But uh, in addition to just the warnings we tend to hear about lumbar flexion, there also tends to be, I don't know if you've heard of this before, but this additional caution that like what's even worse than lumbar flexion is lumbar flexion combined with rotation. Have you guys heard that
Mm.
warning before too?
In a loaded context, especially, but even unloaded too, I think.
Yeah, I
Yeah.
tried to find the research for that a while ago because I think it comes from one study. Do you know the one I'm talking
Mm-hmm.
about, Travis?
No, I've never discovered the origin of this claim.
Yeah, I looked really hard and I couldn't find it. Someone told me that there's like a person that does read research. They said that there's one study, but I couldn't ever find it. So
Interesting.
I don't know where this comes from.
Maybe it's just a rumor or something, like just repeated like oral tradition or something. Travis, can I actually ask you a random question? Or not, it's not a random question, but it was something that you've talked with me before about that I actually thought our listeners of this episode might appreciate hearing about is could you define for us what loaded lumbar flexion is? Because I think sometimes like I
Oh,
know
sure.
I've casually talked about like core work like crunches and called that loaded lumbar flexion, but you told me that's actually not loaded lumbar like loaded lumbar
Oh,
flexion.
yeah. Well,
Can you
so the
kind of
way,
explain that?
yeah. Well, the way that and maybe this is just me, but to me, the loaded lumbar flexion is that the muscles on the posterior side of the trunk, so spinal erectors and everything else that's going to extend the spine, would be working to counteract an external force that's pulling you into flexion. So the example that
Mm-hmm.
Sam gave, good morning, weight is on your back,
Right.
you're you're working concentrically, eccentrically. Your lumbar extensors are working concentrically and eccentrically to fight flexion. And it's like we talked about, it's still occurring to an extent, but you maybe don't want to just like totally fold forward, or maybe you do. But conversation for maybe upcoming. But anyway, that would be the same in a standing forward fold or a seated forward fold, but you don't have weight on your back or in your hands. You're just under the load of gravity. But where that wouldn't be the case is if you're on your back and you're doing crunches, because now you're doing resisted spinal flexion against gravity. So
Mm-hmm.
the load is the opposite. So gravity is trying to pull you into extension. The flexors, anterior core, rectus abdominis muscles are going into flexion. So they're opposite things, and so there's load. There's always
Mm-hmm.
load unless you're in
Mm-hmm.
outer space, whether it's due to gravity or due to a weight that you're holding on your back in your hands. But where the direction of the load, is it pulling you into flexion or is it pulling you into extension? And then by virtue of that, are you resisting extension or flexion? So to me, I only think of loaded lumbar flexion under the context of you're trying to resist flexion by extending.
Mm-hmm.
So the crunch or the sit up, I don't think of as loaded lumbar flexion. But and maybe I just made that rule. Maybe I made that distinction up because it doesn't sound like that. In your mind, that was a differentiating factor. I don't know, and maybe Sam, you think the same way I do, but we have perhaps a similar lens that we're looking at it from.
Mm-hmm.
Yeah, I think it's a really tricky one because, like, if I said, okay, Travis, I want you to do resisted lumbar flexion, you're going to say, okay, well, I'll do like a sit up or crunch, but then that does have load on it, especially if you add a dumbbell or whatever. So then I can understand how it's confusing, but normally, yeah, like when you're saying, oh, well, you don't want to do like lumbar flexion under load is bad.
Right, right, yeah.
Normally, people are talking about it as like what Travis mentioned as, I'm lifting something or I'm standing and bending forward and I'm resisting
Yes.
gravity or external load. I think that's usually the context of it.
I guess the other tricky thing is when anytime this is occurring, there's co-contraction. Whether you're doing flexion or extension, there's co-contraction on the opposite side of the joint. So there is some whatever
Hmm.
force on the spine coming from all directions, no matter where the external load and then the corresponding internal load. Even if you're creating extension, your anterior core is still contracting, and then there's load on the spine.
It makes sense, like 360 degrees or whatever. But that's just, I find it helpful to get a little clearer on that term because I think, yeah, I could see how I just think it's a little confusing. And yet we still have the fear mongering around things like crunches. Like there's still this belief that that's a lot of flexion and it's bad. And I think it just gets confused and thrown in there with like, that's loaded lumbar flexion. But maybe it's like distinct, but the more the issue is just it's the repeated cycles of flexion or something with something like
Well, that's
crunches.
where you usually hear the McGill research extrapolated to say that you shouldn't be doing like tons of high volume crunches
Mm-hmm.
because you're going into flexion. But
Mm-hmm.
maybe that's only because people tend not to do hundreds of good mornings. It's
Mm.
maybe if somebody were doing that, then they would fearmonger about that too. I don't know. But also that's more of a neutral quote unquote. You're not going into as much flexion
That's so true.
in the any of those axially loaded extension exercises as you are in a crunch. So maybe
Mm-hmm.
it's more about maybe it's about the volume, but also about the range of motion.
That makes a lot of sense. Yeah, and like speaking of, you know, actual like loaded lumbar flexion, maybe having like a weight on your back in a squat in the gym or something, or a good morning is another example, or is it a deadlift would also be loaded lumbar flexion. So like kind of
Mm-hmm.
all
Mm-hmm.
three of those classic weightlifting moves are all movements where if we're talking in the gym, now we're talking about adding weight and adding more load, where you might think that's going to make these movements potentially more risky and potentially, places where people could injure their discs or cause a disc herniation if they're not like utilizing quote proper alignment. And I know that there's been a lot of research that's looked at, let's say, I guess, deadlifting technique or just lifting something up off the floor. So maybe you're not even in the gym, but you're just at home and you're picking up a box off the floor. As far as lifting technique up off the floor, aren't there some just kind of established, like there are these different techniques, and historically we've been taught like we should lift with the legs and not with the back, but perhaps like current research isn't really supporting those kind of older cautions anymore. Like what are the different ways you can pick something up, and how is the spine affected?
Yeah, I think as your poll showed, people are still under the impression that that's like the way to do things. And
98%.
yeah, like I don't think it's inherently bad to try to lift things using your legs, but
Mm-hmm, mm-hmm.
having the belief that that's the way to do it, I think that's the actually more concerning thing because we do know that when individuals have a greater fragility belief around their back, they're more vulnerable
Yes,
to injury. And so then if
that's a
the
great
assumption is
point.
that my back cannot tolerate me to bend forward and pick up a piece of paper, well, that's pretty concerning because then you view your back as being extremely fragile. And now that might be an
Yes.
extreme, like maybe people don't think that, but if it's 5 pounds, 20 pounds, 50 pounds, as we start to increase it, then they probably have more and more of a belief around that.
Yeah.
And yeah, like it's just not what research has found because there's a range of studies that have looked at different styles of lifting. So, um, you have the squat style where you bend down, have your hips really low, trying to have a more upright torso, either having your feet flat on the ground or possibly letting your heels lift, versus the most common other comparison is called a stoop style, which is basically forward bending and then picking something up. And
So
there's
the squat is the one that people are usually thinking of when they say lift with your legs.
And stoop
exactly
is like lifting with the back.
the
Is that right?
extreme bad. Don't do that. Yeah.
Right,
Stoop
the one you're
over.
not supposed to do.
Yeah, and then there's a whole range of ones that fit in between. Like there's a stride stance where you're like in a pseudo lunge position and then bending
Mm-hmm.
and picking something up. Then you have a they call it a weightlifter style, which is like in between a stoop and a squat, where you're not as low with your hips as you would be with the squat. Normally, your hips are above your knee height, but you're not letting your back flex as much, and so it's sort of
Mm-hmm.
like this in between, sort of like a deadlift.
Mm-hmm.
Um, and then they've just looked at the amount of back loading in various different ways, the amount of compression, amount of shear, and then looked at how those compare with one another. And honestly, like there is differences, but when you compare the amounts, it's not that drastic. Like there's pretty
Right.
minimal differences, particularly with lower loads. Like if you're picking up something really light, um, virtually no difference. And then when you go into higher degrees of lifting, there is, however, like there's pluses and minuses if we consider stress as being good or bad. Like
Right, right.
I think stress is contextual. Like if you have a bandwidth to tolerate stress, it's good. And if it's beyond your tolerance, then it's just not appropriate for you at the current time.
Mm-hmm.
And when we start to look at, stoop versus the squat style, one has more compression, one has more shear, then they're vice
Mm-hmm.
versa. And so, like, which one is more tolerable for you at the current time as you increase the relative demand? And so, someone might be more tolerable of compression. So then the one style might be way better for them to lift that certain weight. Whereas for another person, it might be the opposite. And whereas if you wanted to increase your tolerance of one of those stressors, you would only do so by lifting with that other style where it challenges you to do so. And
Right.
so, in a way, lifting with a style that you might perceive as bad could actually be to your advantage to allow you to increase the tolerance, the robustness, the resilience of your back.
Absolutely. That makes me think of an exercise that we haven't mentioned yet in this conversation, which is called a Jefferson curl. And maybe I'll just so Jefferson curl is in the yoga world, if we're standing and we fold forward, we're generally cued to hinge at the hips and like try to preserve that neutral spine, I guess, as long as possible till you fold all the way down. But there's another way you can fold forward. We tend not to teach it as much in yoga because it's been fear-mongered about as much. I find it's a little more common in like Pilates, but it would be the roll down.
Hmm.
So you start standing and then, chin to chest, and then you just roll down vertebra by vertebra all the way down into a fold. So that would be like a body weight roll down in a yoga context. But there's also an actual strength exercise called the Jefferson curl, where it's basically, correct me if I'm wrong, but it's basically a roll down and then a roll back up, and you're holding in your hands like weight. You've added load to that movement. So that's a real
Yeah.
thing, right, Sam? And it seems like to people who've been taught that spinal flexion, is injurious, that potentially sounds like a really dangerous movement. What do you think about that?
Yeah, I think, I don't have tons of people do it, and we can discuss why in a
Right.
second. Not that I think
Yeah.
it's bad. I just think that's not necessarily the best intervention unless you want a highly specific type of loading. But
Mm-hmm.
if your goal is to get into deep ranges of lumbar flexion and challenge that with some external load, it is bang on the best you can get. And it is really interesting that you mentioned, like, in the yoga world, you basically don't ever see that. Whereas, like, on the flip side, in the gymnastics world, it is one of the
Yeah.
most common interventions actually for like training the trunk, because for them
It's a great point.
they do tons of like hanging leg raises, whether it's hanging off of a
Mm.
bar against is it called the Swedish ladder when they're the thing on the wall. You know what
Oh,
I'm
that
talking
Oh,
ladder on the wall.
I know what that's called,
Yeah.
but I
I know what it
forget in
looks
this
like, but I
moment.
forget what it's called.
Come
about? Yeah, I
back
think
to
it's called
me.
a Swedish ladder.
I think you might
There's
be
another
right.
name for it.
Yeah.
Oh, stall bars.
Stall
Stall bars.
bars. Yeah.
Nailed it.
Good one,
Yeah.
Travis.
Yeah, so like they'll do lots of basically lumbar flexion in that style. Then they do the flip side, trying to do Jefferson curls to be able to strengthen their pike position to the highest level that they can. And so, like
Yeah.
in that world, really common, really normal. They have no greater incidence of back pain than other populations. So, interestingly,
Mhm.
yeah. So, you know, I've shared a few videos on Jefferson curls. We actually have one on the E3 Rehab channel where I
I
think
think I watched that
Mark,
It's a
yesterday.
good,
It's
yeah,
Mark,
a good
right?
one.
Yeah.
yeah, and yeah, there's advantages to it for
Mhm.
sure. I think
Mhm.
when I have patients who are fearful of lumbar flexion, I have them do it quite regularly just to
Right.
challenge that fear and also to explore some ranges that they may not have been in for a long time.
Mhm.
And typically, when you do it, it often is loaded, but the amount of load is usually quite low. You don't see people
Right.
usually doing it really heavy.
Except for
Yeah.
Olympic weightlifters.
Yeah, so like I'm a competitive Olympic weightlifter, and I've done it with 150 kilos, so like 330 pounds,
That's so much,
and
Sam.
I've done it off a 20-inch
Wow.
box. So
Oh
But
um,
my
that's only like
gosh.
60% of your deadlift or less.
yeah, right
So
around there.
it's relative.
Hmm.
Right. So in general, it sounds like what you're suggesting is that people they can't generally Jefferson curl as much weight as they could if they were deadlifting or squatting or something. Like
Yeah,
it's
I think
you're inherently not as strong in that
yeah,
movement.
I would guess I probably don't see too many people go past even 20%. Yeah, I think normally you see like
Right.
recommendations of like people using like 4 to 8 kilograms in it and maybe getting up
Yeah.
to like 16 kilos.
Yeah,
So
we
that's like,
we we include that in some of our programs, and
I think
on
it's
our
really relevant for yogis.
yeah, but
Like
we
yeah.
flexibility,
are
spinal mobility.
we demonstrate it with pretty light weights. Not to say
Hmm.
Right.
that you can't go heavier, but
And
if
sometimes
you
we've
feel a
gotten
stretch, then that's kind of
Yeah,
that's a that's
right.
where we're coming at it from. Like, oh well, this is a good way to stretch your hamstrings
exactly. Yeah,
and
and that
low back and
that's
all that.
totally agreed. Like if someone is, if I'm working with someone that needs to be strong in those deep positions specifically, which would be
Hmm.
valuable for yoga, gymnastics, I think that there's tons of utility there, and training it regularly is beneficial. I don't prescribe it on a regular basis because I mostly work with like strength sport athletes or team sport athletes who they go into lumbar flexion, but we're talking like, you know, 70% of end range versus 100%. Yeah.
That makes so much sense. Yeah. Yeah. So in more like a traditional, like true strength, like your classic, that makes lift. It sounds like people still utilize lumbar flexion, whether they consciously realize it or not. They are still flexing and they're still loading their lumbar spine. It's like loaded lumbar flexion. But versus like the Jefferson curl is full on, like full range spinal flexion. So there's like a little difference there.
Yeah, like in a standard deadlift, you're probably getting into, again, somewhere between 60 and 80% of your max lumbar flexion, unless you
Wow.
really tried to round it, which I don't think too many
Right.
people do.
No, yeah.
Um, like I'm definitely one of those people who ends up rounding a lot more for various reasons, and so then I probably get into like that 80% zone, whereas other people who look a little bit more flat probably are in that 60% region. Whereas in the
Hmm.
Jefferson curl, like your goal is to get to 100%.
That makes a lot of sense. Can I ask you another question, Sam? Uh, Super related, but a little different. I know we've been talking about like deadlifting technique or just lifting something up off the floor. But I know there's another conversation around lumbar flexion and potential injury, which is something called butt wink. I think some of our listeners will be familiar with that. And you have a great video. I just watched it. I watched your video on the E3 Rehab channel. And my impression, and again, correct me if I'm wrong, but butt weak is something that's a little more associated with a squat movement pattern or like versus the deadlift. I think because you're generally going like deeper and that can tend to cause that to happen. But what is butt wink? Do people caution about it and do they need to?
Yeah, thank you, Jenny, because I was trying to remember what video I discussed that modifiable lumbar flexion in, and that's the video. Thank you.
Yes. You're
um,
well. Yeah, I think you do. You suggest like heel lifts or something in there. I think.
yeah. But in there, I go through like one of the papers, and I can like remember it really well because there's like red lines on it showing like the amount of curve that someone has, and then they
Oh
try to like purposefully
yes.
change it, and it's the 10% or whatever. So
Right.
yeah,
Right.
butt wink is a term that's used predominantly in like the fitness industry. I'm sure it comes up into yoga. Interestingly, it's not, at least previously, it wasn't popular in weightlifting because weightlifters thought butt wink was normal. Um,
Interesting.
uh, um, and it's essentially that like your goal or the perceived goal in a squat is to maintain that flat back position. And then once you get to a certain depth, and that ranges for people, you start to see the pelvis tilt posteriorly, the back starts to round and or round more, and that's thought to be like a bad thing. And so then
Mm-hmm.
people call it butt wink, say don't butt wink. You need to, drop the weight, work on your technique, and spend the rest of your life squatting the empty bar. So um, yeah, that's sort of like the concept around it, and it's I think in some ways it has merit, but it's generally like a really limited concept. If you're someone who's coming into squatting having um, a reasonably strong amount of leg strength and you haven't loaded your back to a high level, you might be a person who might be susceptible to a bit more injury risk if you were to go and have a bunch of butt wink because you just haven't gone
Mm,
into those ranges, haven't loaded them before. Maybe you've done predominantly single leg training, you've done lots of stuff at higher angles of hip flexion, and so then, or lower angles of hip flexion. So, like, you've built a lot of leg strength, but haven't been in those lumbar ranges. Yeah, like
mm-hmm.
dropping it like it's hot in the squat and loading it up heavy might not be the best place for you at first, but that's something that you would
Right.
develop tolerance to over time. Whereas, yeah, if you go over into weightlifting, you will see people butt wink all the time and they think nothing of it. Like, I train out of weightlifting gyms and these people don't talk about it. They don't think anything of it. It's like totally normal for them. And it's just like a lot of things where we know that the amount of lumbar motion is reasonably not going to change whether if you're still going to the same depth. Like the only way you can for sure modify lumbar flexion in a squat is to just squat higher so you don't go as low, because as you go into more hip flexion you will have to go into more lumbar flexion. So if you want to avoid
Mm-hmm.
it, you have to just squat higher. So if we say, well, you're going to go down to a quote unquote acceptable depth, which is usually like parallel ish. So if you say that's going to happen either way, well, then you can't really modify the amount of um, lumbar motion that occurs. But what will change is how much pelvis motion changes or thoracic motion that changes. And I don't think it's anything again that you have to be inherently worried about. If
Mm-hmm.
you're a rational person who approaches exercise in a reasonable format, you will likely consider I
Right.
should start at a level that I can handle and then gradually work your way up versus, I'm going to start and just max myself out on a regular basis and push beyond what I can recover. Well, yeah, you're going to be at more risk of injury, but I don't think that's magically um, the butt
Unique
wink.
to right,
Yeah.
right, right, right. I mean, yeah. It sounds like you wouldn't suggest that butt wink is this inherent risky position. If you just load it intelligently over time, we
Yeah,
should
and
be
you're
fine.
and you're talking
people
about
are like, "Oh, do you not tell athletes not to butt wink when you coach them?" Like, no, I don't. I don't care. It's like if
Right.
you could come into the gym. I have a whole weightlifting club that trains out of here. I have never once told someone not to butt wink,
and
and
you're talking about
Sam.
weightlifting. So when you go to start
yeah,
talking
people,
about butt wink in
yeah,
chair
people,
pose in yoga, it's like this is just our body weight. We don't need to worry about that.
yeah,
Here you are with in the yoga world, like chair pose or utkatasana,
mhm.
which is kind of like the yoga world's like it's not the full deep squat that would be malasana. How familiar you picking and micromanaging that goes on really in so many yoga poses, but especially in chair pose. And a lot of it is about the lumbar spine position and the pelvic position. And
Didn't we ask one time, like, are you have you heard that you're supposed to tuck your tail or untuck your tail in chair pose? And we got both answers. And it's like, well,
Yes.
these two things cannot coexist. One is saying to go into anterior tilt. One's saying that you actually should posterior tilt. So you should tuck the tail. You should butt wink. And you get, I guess, people are talking about both extremes.
And as Travis just mentioned, it's the pelvis tilt that's the biggest thing that ends up changing. Like you're going to have probably a similar degree of lumbar motion, but then the pelvis and hip flexion changing.
Oh, that's right. Oh, that's right. I think the spine is changing, but it sounds like you're saying it's actually probably the pelvis or the thoracic region
Yeah, like there
that
will be
makes the
some
change.
some change, but it's not going to be, especially I guess you said chair pose is like a 90-degree knee bend ish. So then
Yeah,
you'll,
maybe,
you'll have
yeah.
more ability to modify the amount of lumbar flexion there,
Right.
but it's still only going to be so much.
That makes so much sense. Yeah. In fact, when we threw out for questions for this episode, we got a couple questions specifically about that. And we've talked about it before on the podcast. But generally, I think Travis and I would suggest, like, for chair pose, which is this unloaded, yoga pose, it just doesn't really probably matter unless you have like a really specific thing that you're focusing on, for a
Yeah,
specific reason, for a specific individual. Maybe that person does want to specifically, untuck or anteriorly tilt the pelvis or post, like they might have a specific reason, but just as a general cue, it doesn't seem like it's something that yoga teachers need to be
yeah.
controlling in their students.
Probably not. Like it's a higher degree position, but something that I actually do, which is the opposite of what's commonly said, is I'll have people posteriorly tilt their pelvis on purpose during squats. If someone, for
Whoa.
instance, has symptomatic, like a hip pinch in the bottom of their squat, because
Oh,
when you go
yes.
into more of a posterior tilt position, you're in less hip flexion, and so then
Yeah.
it gives you essentially more space at the bottom. And a lot of people find it's way more comfortable. Again, like
It's a
as long as you
great
grade your
point.
way up and build up tolerance and strength there, you're not going to have any risk. Whereas you're less likely to have like bone approximation in your hip, which a lot of people stop squatting deep because of that reason. So it's
Mhm.
a easy solution there.
That's an awesome reason to potentially have someone go out of the way to do that. I love that. I had just like a couple other kind of yoga related questions to throw out at you, Sam, if that's okay.
Let's do
And
it.
these were actually questions that people submitted when we threw out to our listeners for questions. So one of them, and I don't know like how topical this is, but I think it's related. I don't know if you'll be familiar with this caution, but in the yoga world, Travis, maybe you've heard of this before, but there's kind of this like this prevailing rule of like sequencing, like the order that you teach yoga poses one after the other. There's this sequencing rule that you shouldn't sequence back bend, a back, yeah, like maybe full wheel or something. You shouldn't
Mhm.
directly after that have someone come into a forward fold. So they shouldn't go from like full spinal extension into spinal flexion, but instead they should, between those two poses, they should do something to quote neutralize the spine. So
What
it's
would an
supposed,
example of the neutralizing be?
yeah, a good example of that might be like a gentle twist or something is often suggested. So it's like after you do a back bend, you should not go right into a forward bend. Like that's going to be bad or injurious. Instead, do something else. And so like a twist is or maybe a side bend, but I find a twist to be pretty common. And that's supposed to quote neutralize the spine, and then it's safe. Then it's okay to forward fold. What do you think about that? At least in terms of like injury prevention.
Yeah, I don't think that you're at a high risk of injury. The only thing where I think that they're generally, as soon as you said it, I was gonna essentially write it off. However, my one thought with it, and like
Mhm.
maybe Travis can touch on this, is like if you have a big creep stretch on the so like a creep stretch is essentially where you have particularly certain tissues like ligaments where they're held under tension for a long duration will elongate more versus when they're held
Mhm.
to a shorter duration stretch, they're less likely to actually change elongation. And so if you were to go into the backward bend and hold it
Mhm.
for, I don't know how long you have to do that to have a meaningful creep stretch, but let's
Yeah,
say,
that's the question.
yeah, let's say 8 minutes. That sounds like a pretty
8 minutes?
But that sounds like the
So
amount of time you'd probably have to do.
in
So if
yoga,
you
it's
did,
usually like 5 breaths or something.
yeah, in that case, unlikely. But if you did hold for a really long time,
Mhm,
then
mhm.
maybe you would want to be a little bit slower. But I feel like that would just be because you've been in this position for so long that it's kind of uncomfortable to go anywhere else, anyways.
Right, right.
Yeah, that would be the only time I think that would be a factor. Yeah.
I wonder, so Jenny, are there any like passive stretches where you actually, and this would be in a particular style of yoga class, where you actually might be holding an extended position for 5 to 10 minutes?
I think that's a good question, possibly in like a yin yoga context.
Fish pose, is that what it's called?
Fish pose, yes, that's like what you're lying back and you kind of
Mm.
arch up, supported with props. That one, honestly, I don't know yin well enough to know if that's a common yin pose. I see it more in restorative, and in restorative, you don't usually go to end range in your stretches. It's usually just like a little
Okay.
bit of stretch.
Yeah.
So
So it
I'm
would
not
be a
sure that I'd see an 8 minute.
contrived example where you could actually potentially create the scenario where you might not, or where you might want to be mindful of, well, first, but that, so okay, there could be a crazy situation where you might not want to go so quickly into the other
Hmm.
extreme, but the whole neutralizing the spine thing, that doesn't even mean anything, right?
No, it'd just be like you'd want to come out of the end range stretch slow and then just gradually go into the other one because you've been in such a big stretch for so long.
Right. You mean
Yeah.
in that extreme example, like where you've held for so long?
Yeah.
Yeah.
Outside of that, honestly, it might be better to go from flexion to extension right next to each other. Yeah, you just get more motion back and forth in the discs and everything else. So in a way, that might be
Right.
helpful.
I love it. I think that's awesome. And I really like how both of you, in response to that question, you both kind of wanted to think of, well, where's an example where this could actually apply, rather than just like, oh, that's, because it's not never like truly black or white. But the way that that rule is treated in yoga, it's certainly applied just kind of across the board to just, back bend to forward fold. We should never do that. I love how you point out there could actually be some advantages and benefits specifically to going from spinal extension into spinal flexion. That makes so much sense. Can I ask you one? I have one more question to ask you, which this one was submitted by a few listeners, and I also hear this. I get this question a lot myself. So the question is, and Sam, I'm not sure how familiar you are with the research on this. I just feel like it's related because we're talking about spinal flexion. But this is about people with osteoporosis or osteopenia in the spine. There
Mhm.
are cautions, and I think it's even the official recommendation by like Osteoporosis Foundation or Society that people with osteoporosis should not do very much spinal flexion, and that could be injurious. And of course, that comes up in yoga because we have a lot that we do that involves like rounding the spine. Do you happen to have any thoughts on that, like spinal flexion as a risky position for those with osteopenia and osteoporosis?
Yeah. So I know a lot about osteopenia and osteoporosis. I'm trying to think if in any of those stretches would there be a meaningful risk to, because like essentially what you're looking at is in those conditions we're disregarding disc injury, we're disregarding a lot of the other types of injuries and focusing extremely on the actual bone.
Right,
And is
right.
the bone at more risk in these positions? I'm not sure that it necessarily is in an unloaded sense, because theoretically, um, the way that the bone could be at more risk would be through a compression type injury. So that would be like, you fall on your butt, which
Mm-hmm.
I assume isn't really
We
happening.
don't do in
And
yoga,
then
yeah.
the other kind would be like a end plate fracture, which we talked about a bit earlier, and that's the one that's probably more common in weightlifting because there's this instantaneous high amount of strain where the muscle and disc are strained and they pull against that region, and it's just that the end plate is the weak weak link in the chain, and so then
Right.
it's the part that rips, and it's the bone though, and so the bone is actually
Mm-hmm.
not able to tolerate enough, and so that's where if you had osteoporosis you might be at more risk of that. But I
Mm-hmm.
don't think they're a common injury for yoga. So then when you start to narrow out all these different options, it leaves you with, well, like what could happen to the bone. And I don't think that there's much of an actual risk there. Yeah, because surprisingly, when you start to look at like how the bones positively adapt to being challenged, there's a lot of good research that essentially like you put pretty hard challenges to bones and they get better. Like there's been a handful of research in the last 6-7 years from researchers in like Australia and then some in Italy and Europe, where they've been doing things like, for instance, the Lift More trials, where they take people that are postmenopausal, diagnosed with full-on osteoporosis, and they have them do 5x5 on back squats. They do jumping pull-ups and bench press, and they reverse osteoporosis.
So true.
And then similarly, there's some research where they've been doing, this is the stuff I think in Europe, where they've been having them do boxing and jumping, and they do it with like minimal covering on their actual hands. So it's not like wearing full-on gloves. Like I think they just wrap their hands and then they punch boxing bags or mitts. Yeah, and then instead of like wearing a glove, and they actually have improvement in their forearms and upper arms.
Oh my gosh, from all that impact.
Yeah, so from impact, and that's why they do the same thing with jumping, and they have beneficial changes in their feet, tibia, femur, and I think pelvis.
Wow.
So essentially, like they're loading it in ways that commonly are told not to, and then they have positive adaptations to it. I don't think that yoga would necessarily challenge the bones in those ways to have like the same kind of thickening or increased density. However, I don't see how it would have a negative side.
Yeah, it's not nothing, right? Because you're working against gravity. So if that's a lot for you, because you haven't done anything up to that point, but it doesn't have the same potential to create adaptation in the way
like
that
if you're coming off bed rest.
Yeah.
Yeah, but for most people, I think that are just like generally live their day against gravity, they shouldn't be challenging their spine to such a level, or their other bones, that doing a yoga pose would be too hard for their spine.
Right.
Or any of them. Yeah.
Thank you so much for offering your perspective on that. Yeah, I feel like I have like a personal bias around these kind of things, that just in general I want to make it less about position and more about these wider factors like total load and loading history and just injury being like this much bigger picture. So I want to challenge my bias, which is to, maybe suggest like yoga in general could probably be okay doing spinal flexion for osteoporosis. Like I feel like I want to say that, but I also know that that's my bias. And so it's really helpful to hear you reflect your feelings on that.
Yeah, I think variety is the spice of life and the benefit to your tissues, because like most things, like there's a level of which doing it is going to provide benefit. And then eventually, if you push it far enough, and that's relative to each individual person, things will happen. Yeah. But like for most people, they're going to benefit from going into lumbar flexion during yoga poses. And sure, if you go from 0 to 60 minutes of it a few days a week of pushing it, yeah, that's going to probably be too much. But if you ramp up to it, then you're going to adapt in a beneficial way that will make you better at yoga, but also more durable for life, more able to tolerate these different positions. All great things.
That's an interesting point, I think, too, as a very minor caveat of, if you go from doing nothing to doing an hour and a half of yoga 5 days a week, you might be building up too fast. But it's not because yoga is bad. It's because you've ramped up too quickly.
Yeah, exactly.
Totally.
Yeah, like last year I decided that I wanted to improve my swimming abilities. I'm a pretty atrocious swimmer, and I ended up having a foot injury swimming, Travis. But it was because during my kick, I had to resist plantar flexion, and I wasn't used to doing that, and I essentially had like a irritable attachment at my tendon where it was just basically tugged on every time I was kicking because I don't have that much plantar flexion. And I went from essentially like maybe I would do 10 minutes when I go with my daughter every now and then doing 3 to 4 days a week of 60 minutes of swimming. And my body
Yeah.
was just like, whoa.
Yeah.
Which is funny because you look at swimming and you're like, all right, that should be fine. Like you're super fit
Right.
in many other modalities, but that one thing, you're in a lot of plantar flexion. And if you don't have a lot of plantar flexion and you're doing, in 60
Repetitive.
minutes, it's a very, it actually is a somewhat extreme position.
That is
But it's
such a
not something
great.
that you would expect right off,
Mhm.
off the top of your head. You would be like,
Such
oh, well, shoulders, back, knees would be the things that would
totally.
go.
You wouldn't think
Not
foot.
this guy.
Yeah. Thank you for sharing that story too. And just a good reminder that to keep the bigger perspective in mind and that everybody is individual. It's really contextual in so many ways with things like injuries and injury prevention in general. Who would have thought that would happen? But I think it's very cool that you decided back then that you wanted to add on swimming.
To
That's
his
awesome.
credit, you improved a lot. I mean, you're no longer atrocious, or at least you weren't when you were doing it often. You
Yeah, I
look
went
pretty good.
from barely being able to do 25 meters. I mean, like literally like full on thrash mode to get across to I did 1,500
Sam,
meters.
wow,
Yeah.
that's
It's
so
legit.
impressive. It's just
Yeah, I'll
with the
get back
right,
to
yeah.
consistency this winter, and hopefully,
Mm,
goal is to get to 5K. So
that's amazing.
Wow.
I'm very impressed. Uh, well, I certainly feel like Sam has done an excellent job today, kind of addressing all of these questions
He
that,
lived up to the hype.
oh yeah, and more. And he did it in such that characteristic, like diplomatic, positive way that I think we really admire about Sam so much. Sam, could you? I know we talked a little earlier about E3 rehab and stuff, and we will put all the links to all the places people can find you in the show notes. But are there any one or two places you'd like to tell people right now, like where they could go find you and follow your work?
yeah, the easiest place would be on Instagram. I'm dr.samspinelli. I share all the E3 rehab and system athletics content on there. Alternatively, you
Mhm.
can go and check out the Instagram or YouTube for both companies. There's tons of resources. We're trying to, especially the E3 rehab, push out a lot of educational material on a regular basis and just try to deliver as much free content as possible.
And you do such a great job and an impressive job with that. Thank you for that offering and contribution to just all the rest of us who want to learn about these topics. It's like really helpful and valuable.
Yeah, well, it's really great to be on here talking with you guys. You're super knowledgeable, and it's good to be able to learn some more about yoga and see the commonalities of the
Mhm.
things that I notice in other areas, like when weightlifting, where misinformation occurs, and then also the ability for improvement in education.
Absolutely. Yeah.
I
Thanks so much for
I I
saying that.
second that, and that's what makes the collaboration with Jenni so fun is like I come at it from a fitness and somewhat rehab lens, and then
Mhm.
hearing like all the same
The
things,
same.
from a slightly tweaked perspective from yoga. Like that's why we have the podcast Yoga Meets Movement Science. So cool
Right.
to hear you experience like a similar clashing of the worlds,
Absolutely.
colliding of the worlds.
Yeah. And how they can all complement one another and like help each other and coming together.
Yeah.
So, Sam, thank you so much for being here today. I can't wait for people to listen to this. I know they're going to love and learn so much from this conversation. And yeah, thank you.
Thanks,
Thanks for
Sam.
having me on.